Today I want to show you an interesting case, how I approached that case surgically, and the long-term follow-up results. So let's dive in. So this is an interesting case of a grade 2 gynecomastia patient that came to me, and he was really unhappy with two things. Number one, obviously the size of his chest, but also the size of his areolas. And so let's zoom into the before picture here. And you can see he's got a lot of fullness in his chest, but also this areola is just too big for someone with that torso. And so just doing the gynecomastia surgery wouldn't have been enough to make that areola shrink. I have to make that areola smaller surgically. And so that's what it looks like on the front. And the other thing I want to show you guys on the front view is just this bottom heaviness and the shadowing that he has. That's very common for gynecomastia because this tissue is kind of pushing outward and blocking the light, creating a shadow underneath the chest. But let's go to the 3/4 view, and you can see here how much his chest really sticks out. This gyno tissue just pushes everything forward. And you look at this angle here, it's about 95 degrees. And I want you to pay attention to that because when I show you his long-term after results, you'll see how that angle is much higher than the 95 degrees. Again, you can see the size of his areola here, and pay attention to that as well because in the after, you'll see that it's much smaller and more appropriate to his more contoured chest. Let's show you the side view. And here again, what I want you to focus on is, again, how much projection he has, but also the fact that his nipple comes lined up with his belly. Keep that in mind for the after result because when you do these surgeries, the goal is to deproject the chest so everything goes back towards the pec muscle. So now that we've seen the before photos, let's go to the 6-month after. So what did I do? I did gynecomastia surgery with excision of the breast tissue and an areola reduction. And you can see here on the after here on the front view, how much better that contour is. Number one, that shadowing that he has is much better. There's a little bit of difference because there's hair on his chest afterwards. I have all my patients trim their chest before surgery, but you can appreciate how much flatter that chest is, but also look at the size of this areola compared to this areola. Significant reduction. And what I want to highlight here is how well that incision heals. It's just a thin, pale line around the entire areola. That will continue to get even better over the subsequent year. Let's go to the 3/4 view. And remember what I was talking about, that angle on the before was about 95. Now look at it. That angle now is about 150 degrees. So everything's deprojected so it follows the contour of his pec muscle. And that's really outstanding for this result. And again, the areola is much smaller than the before. And then on the side view, you can see now everything's deprojected. It's come back down. Before I was saying how the nipple lined up with his belly. Now it's back, so his belly goes past his chest, which is how it should be in these cases. And again, the areola much smaller and deprojected. So really an outstanding result for this patient's gynecomastia, and it was because I paid attention to the two things that bothered him, namely the size of his chest and the size of his areolas. And if I hadn't treated both of them, he would not be as happy as he is now. So this patient has amazing results for 6 months, and it's only going to get better as far as the quality of his incision will continue to fade. Now, as far as the surgery and recovery, some general kind of facts to keep in mind. Most people take about a week off from work and about five weeks off from the exercise, but you notice an improvement right away, but final results usually take about 4 to 6 months. So I hope this video was educational for you and showed you a little insight into how I, as a plastic surgeon, approach these cases and seeing these long-term results. And if you're interested in seeing more examples of this type of surgery, be sure to check out my website, my YouTube page, and my Instagram page. Until next time, guys.